Let me start off by saying that in this phase of us working towards ending violence against children, I think one of the best things that we've done in Kenya is we've been able to look at the evidence that is there in terms of strategies that work towards ending violence and adapted them in our national response plan, prevention and response plan towards ending violence. So just starting off with that plus point that we have a document that is evidence-based and advocates for evidence-based strategies. Now, some of the challenges that we have is the implementation of this document. Right now, with the support that we are having from URC and USAID, it's allowing us to go out to the counties where we are going to as LVCT Health in consortium with other partners to be able to tell the policymakers at county level that we have this document that has evidence-based strategies. So we've done half the work, that these are things that for sure, if you're able to adapt and implement, it will definitely lead to a reduction towards violence. However, the implementation of this does require resources, and we work in a resource-limited country. So you might find even the impact that we have with this money is not big enough to cause that systemic change where we know it will lead to zero. It will certainly lead to some level of decrease in the prevalence, but just not enough to be able to say we've completely eradicated violence against children. So from a policy perspective, the documents are there, implementation is what can become a challenge. And the unique thing about violence against children and its prevention is that it's a multi-sectoral thing. Health sector has a role to play, the judiciary has a role to play, the social welfare has a role to play, the children's department, the treasury, because all these things need to be financed by the government, at least to be able to see that effort is being put towards it. Bringing everybody together on the same page can prove challenging sometimes, but we do have solutions like technical working groups that we do a lot of deliberate advocacy to make sure that all these key people in all those sectors understand the impact of VAC for them to be able to believe enough in putting resources towards it. So resource mobilization is another thing. The first is implementation of this plan that we have, very, very elaborate plan that is evidence-based. The second one is the resource mobilization. Obviously, that ties into its implementation. If the resources are not there, then it impacts the implementation. The third thing is that from my perspective, how I see it, we are a reactive country. And what I mean by that is until an event occurs is when we invest in it. So there's still a lot of work I want to believe that we have to do, even in terms of changing the service providers, changing the policymakers' perspective, to be more on prevention rather than curative. The whole idea with NPRP is we do not want it to happen. We do not want violence against children to happen. And that's why all those strategies, or most of those strategies, are all about prevention. But then we are working in a system where, even in terms of resource mobilization, it's curative. It's about once the event has happened, how then do we handle it? And now with all the research that has been done, we realize that being on that part of the scale is more costly than actually preventing the violence from happening. So there's a lot of mindset changing, value clarification that we need to do right from the policymakers' perspective to we, the implementers, even to the community, where you don't want cases of violence against children being reported to the chief. How about we prevent it from happening? And the NPRP, that's the National Prevention and Response Plan for Kenya, is there to be able to guide people in terms of actions that they can take to change it. So that's the third thing. We are very curative rather than preventive. And I think for us to have that impact on the prevalence, we really need to change how we see things and be more prevention focused.